Hi, this is Dr. Brian Walsh with fatisnotyourfault.com. Today, Friday, September 26th, it was released that the University of Alabama just did a study showing that statin drugs, which are designed to lower cholesterol, things like Lipitor, for example, inhibit muscle repair, or can inhibit muscle repair. And the higher the dose of the statin, the more muscles are inhibited from repairing themselves. Now, this has a number of implications, but specifically with people who are exercising. If you're exercising, especially in the hopes of reducing cholesterol and becoming healthy, if you're also taking statin drugs, your muscles may not be repairing themselves. Now, I won't go into the whole debate about cholesterol and statin drugs because it's a really long conversation. However, people need to understand the basic biochemistry of statin drugs, how it blocks cholesterol, but also how it blocks things like coenzyme Q10, which is, in my opinion, why muscle repair doesn't take place. And if people have muscle aches and pains called myalgia, CoQ10 deficiency causes this, as well as things like heart failure, which is the opposite of what most people want when they're taking statin drugs. So the next clip is about 5 minutes long, and it shows you the basic biochemistry of statin drugs, how they block cholesterol, and also how they block coenzyme Q10. So I hope you enjoy it, and I'll talk to you after the clip. Hi, this is Dr. Brian Walsh, and I quickly want to go over statin drugs because they are really being overused, in my opinion, nowadays. Statin drugs are in the news, it seems like every week, on something new, from preventing Alzheimer's disease to suppressing the immune system of kidney transplant patients, of course using it for high cholesterol, using it post-gastric bypass surgery, and most alarming and unnerving to myself is that it's now been recommended for children over the age of 8 years old, and it's never been used or even tested on this age group before, so it's kind of a problem. So if you or anybody you know is on statin drugs, I encourage you to educate them on what's going on with statin drugs and why it causes as many problems as it does. So this is called the mevalonic pathway, and it's how cholesterol is made in your body, mostly in your liver. You can see down here that this is one of the end products here is cholesterol. Now, the whole process here doesn't really matter, but each arrow here going down, the first step is one molecule, it's converted into another molecule, and in each case an enzyme is what does it. Now, this is what I want to highlight here, the HMG-CoA reductase. Anything ending in ASE, incidentally, is an enzyme. So to turn this molecule into this molecule requires an enzyme, and in that case it's HMG-CoA reductase. Okay. Now, for those of you that are familiar with statin drugs like Lipitor, they're also called HMG-CoA reductase inhibitors, meaning that a statin drug like Lipitor blocks this enzyme from happening. Now, if it blocks that enzyme from happening, it blocks this process right here from occurring, and this entire pathway no longer is used. So what happens is, because cholesterol is downstream here, if you block this pathway right here, then you will no longer have this pathway going, and you won't have cholesterol being made. And that's fine. Statin drugs like Lipitor lower cholesterol. But if you look, there's also a couple other things that are also being blocked when this pathway is blocked. Not only is cholesterol blocked, and cholesterol is important. It's a precursor to things like estrogen and testosterone, which are important. It's a precursor to vitamin D, which recently in studies has been shown to increase your risk of cancer the lower your vitamin D levels are, as well as the risk of death. It also is a precursor to our stress hormones like DHEA and cortisol. It helps emulsify and digest fats. Cholesterol is really important. It's not the villain that people have made it out to be. Now, the other thing here is ubiquinone. Ubiquinone is also CoQ10, coenzyme Q10, which is used on a cellular level for energy. Now, the organ that CoQ10 is found in the most abundance is the heart, and because it is used for energy, it actually helps the heart to beat. Now, here's what's hilarious, really, to me, is that here people use statin drugs, HMG-CoA reductase inhibitors, to block this whole process from happening, and then you no longer make cholesterol because you're trying to protect the heart. But you're also blocking ubiquinone, or CoQ10, from happening, and CoQ10 deficiency of it causes heart failure. So on one hand, you're lowering cholesterol, but you're increasing your risk of heart failure. Fantastic. That's really a great way to try to prevent heart disease. Now over here is dolicol. This is a little bit more complex molecule, but one of the side effects of statins is something called transient global amnesia, meaning it's sort of a forgetfulness or cognitive malfunction. Now, it's not reported very much because if you forget things and you forget entire periods or chunks of time, you're not likely going to report that because you don't even necessarily remember that it happened, and you certainly don't attribute it to something like Lipitor. So on the one hand, when you take statins, you are no longer producing dolicol, you're no longer producing cholesterol, and you're no longer producing ubiquinone or CoQ10. CoQ10 deficiencies, in addition to heart failure, is why so many people taking things like Lipitor experience muscle pains, or it's otherwise known as myalgia. And people that start taking CoQ10 while taking statins, a lot of times that myalgia or muscle pain will go away. So this is a little bit about the statin inhibiting effects of this pathway here, and how cholesterol is no longer made, but also a couple other things aren't made as well. Squalene, incidentally, has anti-cancer effects. So when you take statins, you block this whole pathway from happening, and now hopefully you're a little bit more educated about what exactly is happening when you take things like Lipitor. If you want to pass this along to friends, please do so. Thank you very much. So there you go. That's a little bit about the biochemistry of statin drugs and how it lowers cholesterol. If you are on statins, consider the fact that cholesterol A is not the villain that it's been made out to be, and it's really since been vindicated in my opinion. And B, statin drugs, I don't think we have any idea how bad these things really can be for us, and the long-term negative side effects like heart failure that could happen in the future. Also, if you are on a statin drug and decide to stay on a statin drug, consider the use of coenzyme Q10 supplementation. You can get these at health food stores, but not all supplements are the same, and there's a lot of hype about different types of coenzyme Q10. A good dose, depending on what type of statin you're on, is about 100 milligrams a day, but again, it depends on the type of CoQ10. Some has better absorption than others. So really educate yourself on that. Thank you very much. This is Dr. Brian Walsh with fatisnotyourfault.com, and have a fantastic weekend.